There's this problem that have survived and is still surviving among men for ages now, and it looks like no one wants to talk about it. And this is actually destroying families, creeping into marriages, tearing marriages apart. And men keep asking, why me? Why is it happening to me? Why is it really happening to others? And that problem is erectile dysfunction. So let's talk about erectile dysfunction today. So simply put, erectile dysfunction is the inability of a man to sustain erection firm enough for sex. That is just it. The man is having erection, but he's not strong enough, he's not firm enough for sex. Now, you might wonder what is causing or what causes this erectile dysfunction. I'm going to group it into four: the physical causes, the psychological causes, the lifestyle causes, and medication causes. Now, the physical causes are or physiological causes are diseases or physiological dysfunctions that can cause someone to have erectile dysfunction, such as heart disease or poor circulation in the body, diabetes, high blood pressure, low testosterone, neurological issues, and any other disease that can impact on the reproductive system of the body. So when these problems are there, there is tendency that you may have or you may be suffering from erectile dysfunction due to these conditions I listed. For example, for heart disease or poor circulation, the penis needs blood to erect. Now, if you're having poor circulation in the body, there is not enough blood going into the penis. The erection is not going to be sustained. Now, testosterone is implicated majorly in erection. If you have low testosterone, if your hormone is not balanced, if the testosterone level in your body is low, you will not be able to sustain erection firm enough for sex. Now, the psychological factors such as stress, anxiety, fear, emotional troubles or issues, relationship issues, previous heartbreaks, and every other psychological thing you might think of. These things impact on the man. Yes, you might think, it's just a heartbreak. It has a long way to go in bringing down your sex drive, in bringing down your libido. So if you're not psychologically okay, if you're not like emotionally balanced and you're going into sex, there is that tendency that you're not going to have strong erection. You might experience erectile dysfunction at the moment. Okay. And stress on its own increases the cortisol level. Now, what cortisol does in your body is that it decreases the testosterone, this hormone that is involved in sexual act. And if it's decreased, there's also probability that you're not going to have firm erection during sex, and that will be erectile dysfunction. Now, the lifestyle factors such as smoking, excessive alcohol intake, lack of exercise, and every other lifestyle, sedentary lifestyle that you might think of. Now, for smokers, there are toxins in the cigarette that you take that affects your reproductive health. These toxins impact on your even your hormonal level, on your sexual drive, your libido. So if you're a chronic smoker, you may need to cut down on your smoking habits. Yes, same with alcohol and exercise. If you're not building yourself, if you're not exercising, and you might be experiencing hormonal imbalance, exercise helps to balance your hormones. So if you're the type that you just enjoy your sedentary lifestyle, you sit down at the place day in, day out, you may need to adjust your lifestyle so as to help you combat this erectile dysfunction. And lastly is medications. You are surprised I'm calling medications. Yes, medications can also cause erectile dysfunction. Medications such as the ones used in treating hypertension, like your propanolol, hydrochlorothiazide, these medications can impact on your sexual drive. What this medication does, mostly some of them, what they do is they decrease the blood flow that is going to your peripheral system, that is going to your reproductive tract, that is going to your penis. And like I said earlier, you need blood for strong erection, right? So if these medications are causing this cutting or decreased blood flow to these parts of the body, there is tendency that you'll be experiencing erectile dysfunction. So if you're on any of these drugs, you may need to get reviewed by your doctor, and please speak up. If you recently commence any of these drugs, the drugs again, I repeat, like your hypertensive drugs, your antidepressive drug, your antihistamine drugs, If you recently commenced any of these drugs and you're experiencing erectile dysfunction, please go back to your doctor and have a review of those drugs so that you know exactly and rule out the cause of or the causes of your erectile dysfunction. Okay. So yeah, these are what can cause erectile dysfunction in men. Anyways, I am Nurse Amara Chuku, and around here we talk real about sexual health. No shame, no myth, just care and clarity. See you in my next video.